we have your points coming up next, and they're in my home state of Wisconsin. So I'm looking forward to that.
Yes, indeed. Today I am talking about your home state of Wisconsin, and specifically Dunn County, which is a Trumpy area on the western side of the state, not far from central Minnesota. So this year, Senator Ron Johnson notched a 14-point margin there, roughly the same that Trump put up in 2020. But Dunn County voters also had a unique referendum to vote on, asking them if they thought the federal government ought to fund a nonprofit national health insurance program. It ended up passing 51-49 and ran 11 points ahead of Democratic Governor Tony Evers, who was reelected statewide, and 16 points ahead of Democratic Senate candidate Mandela Barnes, who lost to Johnson. Now, Wisconsin is one of just 10 states left that has yet to accept the Medicaid expansion included in the Affordable Care Act. Now, John Calabrese, a Dunn County board supervisor, told me that the toll health insurance takes on the county budget helped persuade his fellow board members to allow the referendum to go forward. The county has roughly 350 employees, he said, and insuring them costs roughly $500,000 every month. On the day that the county heard arguments about whether or not they should put the measure on the ballot, residents showed up to tell stories of their nightmare experiences either with insurance companies or without insurance. It also happened that the state had just released its annual Health and Human Services report, and a state official was on hand to walk the county lawmakers through the budget. Now, the board's most conservative member is a guy named Larry Bjork. And when it came time for him to question the state official, that's when the tide changed in favor of the health care program. Let's roll a bit of that.
Supervisor Larry Bjork.
Thank you, Mr. Chairman. I was fortunate enough to serve on Health and Human Services for a number of years, and really recognizes the talents that Chris has. And she's heard me say many, many times, where does the money go? Well, it blows my mind when I look at the financial statement, Chris, and we spend 38% of our budget on behavioral health services. And when in Health and Human Services, and we look at where the money goes, and we see the money going to other counties for bed space for mental health, I guess my question to you is, in listening to the presentations from the public today about universal health care, do you think there would ever be a universal, can the counties get out from underneath some of that 38% of mental health care by a federal program of any sort?
So the state HHS official in her answer talks about the details of the various programs for a while, and she also notes that before Obamacare was passed, Affordable Care Act, let's not get partisan here, in the Wisconsin Dunn County boards, the county was spending about $100,000 a year for uninsured patients at local facilities, whereas that number is now down to about $10,000. So she concludes with this.
But in direct answer to your question, if people had affordable health insurance available to them and coverage to get them the care that they needed when it wasn't a crisis or emergency, it seems hard to not conclude that there would be cost savings to that.
So on election night, organizers noticed a trend. The first was the obvious one, that the referendum was doing better in the county seat of, how do you say it, Menominee?
Menominee.
Menominee, okay. It's a town of about 16,000 people than it was doing outside of it. But they also noticed that in the small towns where they had taken a day or two to talk to people, the numbers were startling. In Boyceville, Wisconsin, for instance, voters went 239 to 132 for Ron Johnson over Mandela Barnes, but they supported single payer by 183 to 171. In Wheeler, Wisconsin, Johnson won 52 votes to Barnes's 27 votes, but the referendum carried by 40 to 37. In Elk Mound, Johnson won 190 to 142, pretty comfortable win there, but National Health Insurance won 184 to 124. So Emily, after I wrote about this referendum for The Intercept, you responded to it by saying this: lack of Republican attention to workable health insurance policy solutions will handicap the GOP for years to come. What did you mean by that? And are Republicans at the top levels kind of recognizing this problem? Or are you shouting into the void here?
Shouting into the void. What was interesting is
Hey guys, ready or not, 2024 is fully upon us now, and Sagar and I have been brainstorming ways that we can really up our game for this critical election.
Yeah, we rely on our premium subs to expand our coverage, to add staff, to upgrade the studio. We just want to give you the best independent coverage of this election, which is possible. So if you can help us out, become a premium subscriber today, breakingpoints.com, or the link is down here in the description video. It really means the world to us, and if you like what we're all about, this is the best possible way to keep us 100% independent, working only for you.